Let's start with what is healing. And this is a point of contest for many people. What is healing and what is health? So in the context of psychoanalysis and psychotherapy, before we go there, let us just look at the simple definition. We say there's something called a symptom, which is an entity which is not normal in a majority of the population, and the symptom causes impairment. Impairment meaning some damage, some dysfunctionality, and that results in suffering. So symptoms lead to impairment, leads to suffering. So if somebody has psychosis, the person may not be able to think clearly. So we say thought is impaired. And because of that, he is not able to live a full productive life and he suffers. A person is in depression, so we say the mood is impaired. There is impairment of mood. And therefore the suffering of sadness, gloom, and many other things. If the symptoms are removed, the impairment is removed, the suffering is therefore removed, and therefore we can say healing has happened. So one simple definition of healing is absence of symptoms is healing. So once symptoms cease, we say healing has happened. Obviously, everything is not curable, and therefore, in many cases, we may not be able to cure all the symptoms. We may only be able to control them or reduce them partially. So there can be a 25% cure, a 50% cure, a 75% cure, or in some cases 100% cure. But we cannot heal everything 100%. So in such situations, arrest of degradation also can be termed as healing. Partial rollback and remission can also be termed as healing. However, this is the definition of modern medicine, and psychotherapy by and large goes by this. Ayurveda, however, has a very different definition. And Ayurvedic definition is that a person without symptoms, he has to be happy in terms of harmony of the senses, harmony of the 7 elementals, what they call the dhatus, and the person has to be of a in somewhat happy or almost blissful state, ananda. And that is a quasi-spiritual definition of health, which is a much higher definition of health, more demanding definition of health than the classical definition of healing that we have. So the definition of healing is different. It is different in psychiatry, it is different in psychoanalysis, it is different in Ayurveda. In psychoanalysis, most schools will go by the psychiatric definition, which is an absence of symptom or control of symptom or a partial rollback of symptom, and say healing has happened partially or fully. One of the psychoanalytic schools by Lacan brings out a very different definition of healing. And Lacan talks about 2 very interesting things. One is articulation of desire. That if you can articulate the desire and the articulation be so profound and so exhaustive that the desire is exhausted. Exhausted in articulation and understanding. Not fulfilled in reality, not necessarily satisfied in reality. But a profound articulation of desire almost exhausts the desire in a special way. And that, according to Lacan, should be the goal of therapy and should be included in the definition of healing. The second concept that Lacan brings in very interestingly is the concept of symptom. Symptom is near to symptom, but what he does is he separates symptom and suffering. And the idea there is that in the course of psychotherapy, the person may have a partial rollback of certain things, and there are both possibilities that he may be fully cured or he may be partially cured. In case after best of efforts also, if he is only partially cured, then whatever remains, the last 25-30% of what remains, the person starts understanding it profoundly and accepting it so profoundly that the symptom then gets divorced with suffering. That much of the suffering which was previously linked to the symptom drops out and very less suffering remains with the symptom. And with that, the person learns to live. And that symptom in that particular state is what he calls as a symptom. So we can see very different approaches to healing, very different definitions to healing. Approaches, of course, are different. Psychiatry has a different approach to healing through drugs and pharmacological approach. Psychotherapy believes in the talking cure, and homeopathy also is in the same arena and does good job in the area of mental health. And in homeopathy, the root of the road of cure is very different from both psychotherapy and psychiatry. It is through medication, but medication of a very different type, given on a very different basis. The basis is psychological, plus the body, but a very different approach. I won't go in details. I will leave this point half complete here. Some other time, if we get time, we'll discuss about it. Let us take up the next concept of active and passive healing. You can, if you look at all the healing approaches, you can divide them into two: active healing and passive healing. Psychotherapy healing is active healing. The person has to participate in the healing process. Whereas, if you look at psychiatry, if you look at homeopathy, anything where medication is given, it's a very passive healing approach. You take the medication and the medicine does its job. You don't have to do much. Similarly, in Reiki and Pranic healing, the holistic healing approaches, both are possible. If you do Reiki and Pranic healing yourself to heal you, you are doing active healing. But if you pay somebody to do healing for you, it again becomes a passive healing. Needless to say, passive healing is very comfortable, very easy, and the first choice for most people. Active healing is difficult, it is painful, requires a lot of effort and readiness and motivation. But one good part about active healing is this. In active healing, as it is in case of psychotherapy, two objectives are attained: healing and self-growth. Healing is not alone. Apart from healing, self-growth also happens, which may not happen in passive healing. In passive healing, only the symptoms are being addressed, or certain parts of personality are being addressed unconsciously. But in active healing, the whole personality gets addressed in one way or the other. And the insights which develop during the therapy process, they help the person throughout his life. And this preparation, this therapy process experience also becomes a preparation for any new challenges which might come in future. Passive healing usually is cheaper, it is quick, because medication is doing the work The healer is not involved beyond a point. So a homeopathic doctor or a psychiatrist does not have to sit with you for a 1 hour session twice a week, every week. They can just give you medicine for 1 month and you are done for 1 month. Contrary to that, a psychotherapist has to sit with you because he is practicing active healing where you are participating for full 1 hour, maybe once a week, twice a week, or even 5 days a week, based upon what is the situation. So active healing usually is costly, time consuming, difficult, requires lot of motivation. The person has to be ready to see the most difficult parts of himself, which not everyone is. Many people just don't come into therapy because of it. Many drop out in the middle because of it. So active healing is difficult, but it is deep, rigorous, thorough, involves self-growth, helps in other parts of personality, enhances overall quality of life far beyond just the addressing the symptom, and prepares you for future challenges. And some of these components are not benefits that you see in passive healing. So most people would like to go for passive healing, but it has its own limitations. If you look at mild, moderate, and severe situations, in mild situations does not matter, but in moderate and severe situations, I believe it should be active healing or a combination of active and passive, but never only passive healing, unless the difficulty is so peculiar, right? Or the person's system is such that it responds only to passive healing. So preferred is to involve active healing if one can afford it in terms of money, time, energy, and ability. If not, then of course passive healing always is the default condition. And in passive healing, one can go for psychiatry or one can go for homeopathy based upon the preference, customers, the patient's rights, and what works best. Or we can have a combination of psychotherapy with psychiatry, psychotherapy with homeopathy, and on. Psychoanalysis, ISTDP, EDT, they are extremely active forms of healing. So even within psychotherapy, when we say in psychotherapy, all forms of healing essentially are active forms of healing. Some are more active than others. And the kind of demands that psychoanalysis, ISTDP, and EDT makes on people is very high. So unless the person is highly motivated for an inner journey and ready to face very difficult parts of oneself and bear the pain and come out in the process of growth, these approaches may not work out for everybody. So we require an extremely motivated person with some psychological orientation and an intense desire for an inner journey and improvement of one's quality of life in a deep sense when psychoanalysis, ISTDP, and EDT work out. Later on, we will see what kind of clients we can take and what kind of clients we cannot take for psychoanalysis. Till now, do you have any questions?
No.
No.
Now let us go into what psychoanalysis is. I had said before that different psychotherapies focus on different elemental players which are at the root of the psychological drama. Right? Psychoanalysis focuses on the unconscious mind. So, if you ask what is psychoanalysis, it is an approach to understanding and healing of human mind which has these characteristics. First, existence of the unconscious. Psychoanalysis believes that a larger part of our mind is unconscious, outside of our awareness and control. It exists with a great degree of autonomy and creativity and desire. And it is a place where strong desires, unacceptable thoughts and wishes, strong energetic movements, and many other things exist outside of our awareness. Example is given of the tip of the iceberg. That part of the iceberg which is outside of the water is what we call is our conscious mind. That's a much larger part which is inside the water and cannot be seen is our unconscious mind. So the first principle of psychoanalysis is existence of unconscious. And unconscious does not only exist, but the interesting point in psychoanalysis is that most important elements or processes happen in the unconscious mind, which includes generation of pathology and healing of pathology. So generation of psychological difficulties and healing of psychological difficulties, essentially a major part of it happens in the unconscious mind. So unconscious mind is not just outside of awareness and control, but it is a really motive player, a cardinal player in generation of pathology and healing of pathology. And without it, without understanding the unconscious, the principles of unconscious, the events happening there, we can't understand pathology fully. Second, the concept of psychic determinism. It means nothing happens just like that. The person does not get depressed just out of nowhere. So there is a cause-effect relationship always. And most of the times the cause is unconscious. But nothing happens without a cause. Third, primacy of childhood. That the childhood is more important than later period of life. That does not mean that in the later period of life, pathology cannot develop. If you get a very traumatic experience as an adult, of course, pathology can develop. But in most of the cases, 75% of the cases, the roots of strong difficulty are found in the childhood, the first 7 years of age, within which first 5 are more important and within which the first 3 are even more important. So it is the first 3 years of the life which are the most important for a majority of cases of moderate to severe type. Coexistence of reality and fantasy. Psychoanalysis believes that all human beings operate with reality and fantasy together. There cannot be any human being who does not have fantasy, and there cannot be any human being who never lives in reality even for a moment. So human beings live in reality and fantasy together. At present, when we are discussing something very logical, we are in reality. But after the session is over, if we go on taking a ride and we drive our car or two-wheelers, very soon we might go into our dreams and our fantasy life will begin. Whenever we have nothing to do, the fantasy life takes over. So we have daydreams and we have night dreams. And we all love to enjoy our fantasies. And desires which cannot be satisfied in reality get satisfied in fantasy. Fantasy, psychoanalysis believes, is of two types. Fantasy which starts with F-A-N-T-A-S-Y. There is a mistake in the slide. It should have been F-A-N-T-A-S-Y. So F-A-N-T-A-S-Y is the fantasy which comes up in dreams, daydreams or night dreams. And there is a fantasy P-H-A-N-T-A-S-Y, more used as a concept by Kleinians. We'll come to that what it is. These are the fantasies which are completely unconscious, which have never even come up in dreams. It's only in very deep therapy, when we go for a long-term therapy which is deep, that these fantasies come out. Or in ISTDP kind of situation or EDT type of situation or any intense meditative situation, when the unconscious really unlocks and the deepest of parts come out, that this fantasy comes out. So we look at two fantasies, F-A-N-T-A-S-Y and P-H-A-N-T-A-S-Y, and all human beings have both of it. Till we have our sense of reality intact, we are sane. When we cannot differentiate between reality and fantasy and start mistaking fantasy for reality, psychosis sets in. So that's the most difficult of troubles, that a person is not able to differentiate between reality and fantasy. And this brings us to two categories of problems that psychoanalysis talks about. We will come to it again when we talk about the language of psychoanalysis, neurosis and psychosis. So we can divide from psychoanalytic standpoint all psychological difficulties into two: neurosis and psychosis. Neurosis, where there is a psychological difficulty, but there is no confusion between reality and fantasy. In our language, we say reality testing is intact, meaning we are not mistaking fantasy for reality. We know they are different. We have an insight that this is fantasy, this is reality. So all psychological difficulties, be it obsessions, compulsions, anxiety, depression, any sort of psychological difficulty, so far as the differentiation of reality and fantasy is intact, all those psychological problems we group under neurosis. And whenever we have a psychological difficulty where there is a confusion between reality and fantasy, and we cannot separate fantasy as fantasy, the insight is lost. We call that set of psychological difficulties as psychosis. So we can divide all psychological difficulties into two: neurosis and psychosis. We'll come to it later again, but for the moment, we just make a note of it. Psychoanalysis also believes that psychological health is on a continuum, which means the healthy and the sick are on the same continuum. Right? These are not two binaries with a gulf in between. Any person can move on the continuum from health to sickness or sickness to health. I always say sanity is a process, it is not an acquisition. What do we mean by that? Any ideas?
We can't be on the same page every time.
Right. And nobody can guarantee like psychological health or sanity. Extreme sanity is extreme, but if you look at psychological health is not a table or a chair that once you purchase, it is yours forever. It is a process. Any person deeply traumatized can move from a state of health to a state of sickness. And if you deeply talk about it, right, in a psychoanalytic sense, not in a psychiatric sense, but in a psychoanalytic sense, very few people in the world would come out to be healthy. Even those who are healthy by psychiatric standards will not be healthy by psychoanalytic standards, which are much stricter. Of course, we use the psychiatric standards for our discourse, diagnosis, and everything, but in a very Puritan sense, in the psychoanalytic sense, the standards are much stricter. So even if you may not qualify psychiatrically for a pathology, psychoanalytically you can qualify. In that sense, very few people actually are psychologically healthy. Psychoanalysis is a very powerful theory of the internal world. There are many theories of the internal world. If you go into the model of the mind, if you go into theories of personality, if you go into the theories on working of the mind, there are many theories available. Psychoanalysis is one of the very powerful theories of the internal world. One way to look at it is to say it is trying to create a science of affect. It is a psychoanalysis is a science of the unconscious mind and the science of affect. Doesn't go much into the thought part of it, doesn't go much into the behavior part of it, but primarily it is on affect. The unconscious phenomena and the unconscious affect. Now, whether it's a science or not, we'll come to it. You may call it an inexact science, not an exact science, but if you look at the flavor of it, it is an inexact science focused on the unconscious mind, its phenomena and affect. And the process here of healing is by awareness, integration and catharsis. That how do you heal? You make the unconscious conscious, you become aware of what you were not aware before. You integrate that into consciousness. And integration is very important because, as Lacan says, we are a very disintegrated entity inside, but we appear to ourselves as a coherent one, whole. And we believe we are consolidated, aligned, integrated, one whole. But when we dig deeper, we find completely disintegrated situation there. So integration is a lifelong process, and this is not a default condition. So one has to really work using psychoanalysis or any other spiritual technique or psychological technique. But integration is a long process of personality development, healing, and quality of life enhancement. It is not a default condition. In psychoanalysis, we place emphasis on awareness and integration. So what was unconscious becomes conscious, and we slowly try to integrate in awareness. Psychotherapy can be done based upon many schools in psychology. If you do psychotherapy using psychoanalysis and the theory of psychoanalysis, that psychotherapy you call as psychoanalytic psychotherapy. This is what we are going to study. That if you do psychotherapy based upon the knowledge of psychoanalysis, we call it psychoanalytic psychotherapy. Just as if you do it on the basis of cognitive science, you call it cognitive psychotherapy. Or if you do it on the basis of behavioral science, you call it behavioral psychotherapy. So psychotherapy based upon psychoanalysis is called psychoanalytic psychotherapy. Now there are two words which people use, psychoanalysis and psychoanalytic psychotherapy. The two are different. Pure psychoanalysis is not focused on healing alone. It is focused on self-exploration, self-knowing, self-development. Healing is a small component of it, whereas psychoanalytic psychotherapy is focused essentially on healing. So psychoanalysis in a pure form is much longer and has a slightly different flavor than psychoanalytic psychotherapy, which is focused and shorter compared to classical psychoanalysis. Out of 100 people who come to psychoanalysis, only 1% come for pure psychoanalysis. 99% of people come for psychoanalytic psychotherapy. And in India, it is even lesser. I think 0.01% people would be coming for psychoanalysis, and 99.9% would be coming for psychoanalytic psychotherapy. Now, the question is psychoanalysis a science? So this is a raging debate, goes on voraciously from both the sides. Those inside do believe it is a science, inexact science, of course. It's not like physics or chemistry or mathematics. It's an inexact science, more on lines of inexact sciences that you find in humanities and social sciences rather than pure sciences. There were many critics. Karl Popper has been a very strong critic of psychoanalysis, and the difficulties are this. Because we are dealing with the most intimate and the deepest part of a person, the person can speak and discuss those things only in absolute confidentiality. And because we cannot use the material or we cannot record it, generally speaking, ISTDP of course now records, but classically psychoanalysis, because we don't record it, it's very difficult to have empirical testing of psychoanalysis in terms of the process. There is another very important element to psychoanalysis. The outcomes of psychoanalysis often are unknown, unpredictable. For example, you may go into psychoanalytic psychotherapy for a particular purpose. Let us say you go there for depression. And some other area of life which you have never discussed in the first place, that automatically gets healed, even though it was never discussed in therapy. Now, that kind of situation which often happens, the confidentiality which does not allow scientific investigation in many ways. Psychoanalysis also is very amorphous. You don't have a strict timetable. Unlike CBT, where you can say 12 sessions on one particular problem. Here, it's a very fluid flow. So it's very difficult to analyze in a strict scientific sense psychoanalysis, and therefore many people believe it is more of a craft rather than a science. But the traditional safer view is that it is an inexact science. After so many years, enough studies have been done, and recently there is a very good confluence of neurology and psychoanalysis which is happening. And many questions of psychoanalysis which were previously out of bounds of scientific research now are within the boundary of research. Next 5 to 10 years are very exciting. I personally feel much of psychoanalysis will get validated scientifically in the coming decade. Any questions on this?
No.
In fact, Karl Popper used to call psychoanalysis as at the same level like astrology. Completely unpredictable, at times getting results. But that I think is a very uncharitable view of psychoanalysis. I am one of the fervent admirers and fanatic followers of psychoanalysis in one sense. So I do believe it is an inexact science. In some situations operates like a craft, but definitely it is not anything less than an inexact science, occasionally a craft. So Zoom says it's 4 minutes to go. So I'll stop this session and send you another link.
Okay.